Hello, my name is Jennifer Coulter, and I am 1/3 of the Substance Abuse Service Systems Group, along with Kelsey Hawkins and Draven Ward. And we're just coming to you today just to do a quick synopsis of what we have found as we begin to research this group and this population. So before we get into that, first and foremost, what is substance abuse? So substance abuse is a very serious social problem that has tragic, far-reaching effects on everyone who's involved. So substance abuse has a major impact on individuals, families, and on the community. When a person is struggling with substance abuse, their brain changes over time because, they're inserting a foreign chemical into their body, and these changes can affect a person's self-control and their ability to resist the urge to use the drug or drink alcohol. And so these changes make drug and alcohol addiction a relapsing disease. So this is why we see people who may be in recovery go back to substance abuse or have a lengthy history of getting off of the substance and then going back to the substance. Some of the signs of substance dependence can be tolerance to or the need for increased amount of the drug. A person can experience withdrawal symptoms if they are not using that drug. So, sometimes in movies that's shown as a very painful experience, and it is painful for someone if they're not using that drug because their body has now become dependent on it. Spending a lot of time to get, use, and recover from the drug. So if you can think about all of the time people spend trying to find this drug, whatever their drug of choice is, or trying to use it, and the time that's wasted during that period, and then also recovering from that drug, in and out of rehab, or feelings of disappointment and things like that with their family. There's also social withdrawal. So people who may be dependent upon a substance would be withdrawing or removing themselves from social interaction. So they may not be with their family as much. They may not be with their friends as much. They may be missing work a lot. So that is a sign. And then also continued use, even though they know it's bad for them. So we know that this substance makes us feel bad. We know that we're out of control. We know that we are not getting to see our family or spend time with their family, but we can't stop using it. And so these are just some of the signs of substance dependence. Now, some of the most frequently used substances are alcohol, marijuana, prescription medication, meth, cocaine, opiates, hallucinogens, and then also inhalants. And so typically one would use these types of substance as they, as we talked about those dependence factors, they would be dependent on this. So then therefore they would use these to excess and experience some of those dependence symptoms. We also come to find that we really can't pinpoint, why one person would use substance abuse over someone else. It is a combination of many different factors. So genetic vulnerability, environmental stressors, social pressures can cause substance abuse, individual personality characteristics, and psychiatric problems, mental health issues. These can all play a part in the probability that someone would, abuse a substance or even allow substances to enter into their life. So if you think about yourself, let's think about drinking, for example. A lot of people drink socially. Most people would not even had drink if someone did not introduce them to that drinking. So social pressures could definitely be that. If you have a stressful job, you go home, you have a beer or a glass of wine, or maybe someone may go home and smoke a joint, or I don't know if they call it joint still, but marijuana, and then then the next thing you know, you feel like you need that to be able to cope with what's going on. Sometimes too, populations that don't have as many resources, which typically are minority populations, who have to deal with extreme adverse environmental stressors like racism, poverty. Sometimes they will use substances to escape from those circumstances. So these are just some of the reasons why one could use substance abuse, or one could abuse a substance, and even how a substance could be introduced into their life. When we think about people who are from, who have adverse situations in their life, we see, poverty, for example. If you live in an area that may not be what's considered the good part of town, or a poverty-stricken area, there might be more drugs available in that area than other areas. So that could also be environmental. So here's some facts nationally. So in the United States, there were over 67,000 drug overdose deaths. And that was reported in 2018, 4.1 fewer deaths than in 2017. The age-adjusted rate declined by 4.6% to 20.7 per 100,000 standard population. And the decline follows an increasing trend in the rate from 6.1 in 1999 to 21.7 in 2017. So, we see that there is, there were fewer deaths as far as drug overdose, but we have seen that, especially during COVID, some of the research that we found that drug use has actually spiked, and alcohol use had actually spiked during 2020 due to, COVID-19. And so I wonder too if that was just exposed because of the circumstances, but that would be something interesting to continue to look into. The two states that we chose were Kentucky and North Carolina. So in Kentucky, there were 989 deaths. And this was also a decrease from 1,160 deaths, which is a positive thing. And then prescription opiate involvement deaths decreased from 433 in 2017 to 315. Deaths involving heroin continued to decline, and then deaths involving synthetic opiates, other than methadone, that remained stable, but high. So it was 744 in 2018. And then in North Carolina, an estimated 79% of drug overdose deaths involved opioids. And this was a total of 1,783 deaths, which we can see in the chart here to the right. And then deaths involving prescription opiates declined from 659 in 2017 to 489. So we have seen drug overdose deaths declining, but of course that heroin or synthetic opiates, those have remained stable. And that was with a respective 619 and 1,272 in 2018. So as we continue on, statutes, regulations, and policies, Substance Abuse Mental Health Services Administration, which is also SAMHSA, serves to aid with substance abuse and mental health within the communities. So this was established by Congress in 1992 to improve access to education, information, and resources regarding substance abuse and mental health. So we have some different regulations and policies, and if you can explore our wiki to see even more. These are just 6 that I chose, but as I said, there are some that are, there are many more than this. And so the first one, which is the Support Act of 2018, that stands for Substance Use Disorder Prevention, that promotes opioid recovery and treatment for patients and communities. And again, that's the Act of 2018. And the purpose of this act was to address the opiate epidemic. And so it provides state targeted response grants. It also is a first responder training. It provides first responder training. So that's programming to train first responders on how to administer, medication in the event of an opioid overdose. And so it also includes safety trainings regarding fentanyl. And then it has a comprehensive opioid recovery centers and requires HHS to issue best practices in recovering housing. And then we also have the 21st Century Cures Act, and that was created, the Interdepartmental Serious Mental Health Coordinating Care Committee, which was a very positive committee in hopes to combat opiate and drug substance abuse. It was created the National Mental Health and Substance Use Policy Laboratory, which promotes the use of evidence-based practices and service delivery models, and it also evaluates previously effective models for development. We also have the CARA Act of 2016, which stands for Comprehensive Addiction and Recovery Act. And so this strengthened prescription drug monitoring programs. It increased educational efforts, so educating people on substance use and abuse. And it collaborated with the criminal justice system and stakeholders, and also expanded the availability of Narcan, which is a medication that can help revive someone who is experiencing a drug overdose. We also have the Affordable Care Act of 2010. And so that made insurance more available and affordable to individuals, families, and small business owners. And there are special insurance protections to help those with mental health and substance abuse issues get private insurance. So that is also something that was difficult for people who have substance abuse. So, if you feel like you can't afford to go to the doctor or go to treatment, then you may stay in that space. So the Affordable Care Act of 2010 definitely helped with the substance abuse education and treatment. We also have the Mental Health Parity and Addiction Equity Act of 2008. So this requires insurance groups offering mental health or substance use disorder coverage to be comparable to that of general medical coverage. So again, we're looking at the cost of substance abuse and treatment. And so this allowed it to be more affordable for those who are seeking treatment. And then the last one that I'll discuss is Sober Truth on preventing underage drinking, and that was the Act of 2006. And this is actually STOP. The acronym is STOP. And so this authorized a grant to provide funding to current or former grantees under the Drug-Free Communities Act of 1997, which aims to prevent and reduce alcohol use among ages 12 to 20 years old. It authorized a national adult-oriented public service media campaign. And then it also authorized the Interagency Coordinating Committee on the Prevention of Underage Drinking, provides coordination between SAMHSA and other federal agencies. So these are just some of the state regulations and policies. And I do encourage you to check out our wiki and read more about these policies, in addition to several others that have been created to help combat and support families and individuals who are dealing with substance abuse and seeking treatment. So this is just a short video about Casey's Law, and this is a significant law. So I'm going to play this video, and then we'll talk about Casey's Law just a little bit.
Sometimes looks can be deceiving. In a neighborhood where dogs are about the only break in the quiet, there is a family that's breaking the silence of a painful past.
And it says, "Dad, I'm addicted to heroin. I need help." Yeah, didn't see that coming.
Still bothers you?
Yeah.
Why?
Hurts. I'm sorry.
It's been a long 8 years for the Collinsworths.
The first one was Louisville. I'm trying to remember
The first one
long
was the
term.
one in Richmond that we took her down and she left
Okay.
immediately. Remember, we went from there, from
I
Georgetown to
lose
there.
track all.
Their daughter, Lindsay, has been to almost every state-run drug treatment center around.
You always thought they were going to work, or you hoped that they would work.
But Lindsay would never stay.
There's nothing that keeps them in these treatment centers if they don't want to be there.
Pictures sit around the house of family visits,
And this was taken when she was at the facility in Warm.
but each picture wasn't proof of success, but part of the path to a law the Collinsworths believe changed the game and saved their daughter's life.
Sucked. It's not fun. So, but you knew it had to be done.
Rusty Collinsworth signed a petition, a court order, that Lindsay was going to treatment or jail. It's called Casey's Law for involuntary treatment. If a person leaves treatment without the court's consent, a warrant is issued for their arrest. Lindsay left treatment and failed a drug test.
And it said, hey, my daughter's at our house right now, and can you come arrest her for me?
She spent 30 days in the county jail.
If you would have asked me 10 years ago if I would have ever been proactive about putting my child in jail, I would have said, you know, it's crazy.
Casey's Law has been around since 2004. For the Collinsworths, it became their last hope in 2015.
We were convinced we would be burying Lindsay. You know, Rusty and I have talked about plans, you know, actually details where we, I mean, it was.
I even asked Lindsay. I said, what do you want me to put on you? Because it's going to happen.
I was possessed. I feel like I sold my soul to the devil when I was on heroin.
Today, she is 10 months sober.
I wanted to stop, but I was so physically sick that I couldn't.
But her parents could. Her mother remembers waking her up to tell her the police were there to arrest her.
Part of me, though, was glad because I knew that the fight was over. You know, like I knew I wasn't going to have to get high for at least as long as I was in jail.
Casey's Law isn't an easy out for family and friends. The petitioner is responsible for the cost of court fees and treatment, and for finding treatment, which can be challenging. But the alternative, the Collinsworths say, wasn't an option.
Now you're trying to save a life.
You know, you just have to be persistent and become an advocate for your child.
And this was actually the second time the family had tried Casey's Law. They tried it in 2009, but the warrants weren't followed through. They say now, with the emphasis on the drug epidemic, the warrants are taken more seriously. The second time around, they tried last year, and their daughter, as you saw, ended up in jail and when she had left treatment.
Something so many of us can't really imagine, but we know it's happening. This family talked to you a lot about the struggle to even find treatment centers.
Right, and once you do Casey's Law, you're not just turning them over, you're still responsible, and the waits can be up to 6 months, but as the mother said, you have to be an advocate, you have to be persistent, and keep at it.
It may have saved her life.
Yes,
right?
they think it did, yes.
Miranda, thank you.
Okay, so that was just, as I said, a quick video about Casey's Law and a family story regarding their experience with Casey's Law. So let's talk about Casey's Law for a little bit. So Casey's Law is a law that allows for the intervention of a person that is unable to distinguish their need for treatment because of their level of impairment. So relatives or friends may petition the court in an attempt to get this person entered into a substance abuse treatment against their own will. So a little background about Casey's Law. The Matthew Casey Wethington Act, which is what Casey's Law is named for Matthew Casey Wethington, who died in 2002 from a heroin overdose at the age of 23. So he was very energetic, is how his family, would describe him. And he did not intend to become addicted to drugs when he first tried it, but he did not realize that in doing so, that is, he began to become dependent on the drug. And so his family had said that his life was taken by drugs and and in living. So while he was alive, his life was taken. And then ultimately he perished because of his drug use. Although his parents tried to get him help, there was no law at the time that could force someone into treatment because he was an adult. And so after Casey's death, his parents lobbied for a change. And Casey's Law was passed on April 9th of 2004, and it took into effect July 13th of 2004. And so, as we see in the video with the other family, their daughter actually benefited from Casey's Law. And she has been 10 months sober as of the time of that video. Now, I want you to think about this and then answer this on our blog facilitation this week. What are your thoughts on this law? What do you think about this law? Do you think that someone should be able to make their own decision, whether impaired or not, if they want to go into treatment? Or do you think that it is a good thing that relatives or family can go to court and petition the court to make their family member, their loved one, go to treatment against their own will? Something else to consider too is when we watch that video, the daughter, if she were to leave treatment, or son or whomever, they were to leave treatment, then a warrant would be out for their arrest, and they would be arrested and put in jail. And so, some parents and some family members or friends may be uncomfortable with the thought that their loved one would be put in jail. But there is, tough love. Some people are really adamant about tough love, and they feel that the jail for their loved one is just a very small price to pay in hopes that person would become sober and live a life of sobriety. So yeah, I'd be interested in seeing what your thoughts are on this law and what you think about it. One thing I would add as well, and that we've learned about in class, and I'm sure in other social work classes that we've taken, is the importance of everyone being where they need to be and doing what they're supposed to do. So this was that family's second attempt of doing Casey's Law. The first attempt didn't work out because the warrant was not, they did not actually act on the warrant. The governing officials, did not act on the warrant. So things are only as good as we as human beings make them to be. So, if you are one who thinks that this law is good, maybe add something about how you feel about the police not actually acting on the warrant, or maybe the judge or whomever not acting on the warrant. So I'm very interested in seeing what your thoughts are on this law. We've also found some different types of program funding for these programs, these many programs that people are involved in or can be involved in regarding substance abuse. And so some of these programs you see as listed on the slide: substance abuse prevention and treatment. That's a block grant. We also have Medicaid treatment and prevention in public housing, which was something that I actually found very interesting. And then vocational rehabilitation, child protective services, social services block grant, and criminal justice. So the substance abuse prevention and treatment block grant, regarding this grant, 35% of the funds are saved specifically for prevention and treatment services that relate to alcohol abuse. Another 35% is allocated for activities related to drug abuse, and then 20% of the grant is used for prevention activities, and then 5% of that grant is used for administrative support. We also have Medicaid, and Medicaid is under the Title XIX of the Social Security Act, sets aside funding for substance abuse treatment for individuals who are eligible for Medicaid. And I found that both Kentucky and North Carolina offer this for their residents of that state. We also have treatment and prevention in public housing, which, as I said, I found interesting. So there is money. HUD provides funding for substance abuse treatment programs in public housing. And so these types of programs can include substance abuse prevention, referral and treatment, job training programs, can also be held within the apartment complex of these public housing facilities. And these are programs that people who live in the facilities can attend. We also have vocational rehabilitation. So this particular grant is funded by the U.S. Department of Education, And the purpose is to provide support services to enable people with disabilities to participate in the workforce. And so services that are eligible for this funding include substance abuse disorder assessment and treatment. They also can get prescription medications, equipment that enables disabled individuals to have access and function in the workplace, such as wheelchairs, hearing aids, and certain computers, and then also offers transportation. We also have Title IV of the Social Security Act, and this provides funding for foster care. And eligible services include substance abuse treatment for parents who are ordered by the court to obtain treatment and are at risk of losing custody of their children. And then lastly, we have criminal justice. And so there is, we do have, the Department of Justice has a program called Weed and Seed Program, which is actually not in Kentucky or North Carolina, but this program functions with intentions to reduce drug activity in target communities. Substance abuse treatment for residents of target communities is an eligible service. So these are some of the fundings, ways, some of the program funding that's available for these different services for people who have substance abuse and their families. And then we also, lastly, we have interagency coordination and collaboration. And so there's different things that are available, many different avenues for someone as they approach treatment. And so the first is harm reduction. So harm reduction can be something like needle swaps. So if someone uses a needle, they, instead of using a used needle, they would swap out a used needle with a newer needle. And so some people feel that that is actually promoting it, but it's actually not, promoting it really. It's just providing a safe space for people who, are have drug use and they may not be ready to stop at that moment. Harm reduction is actually can be very successful. We also have medication assisted treatment, which is also known as MAT. And this is when an individual uses a specific drug to help them when they're coming off of drugs. So for example, someone who uses opiates would use, Suboxone or methadone, and this can help them, ease off of those drugs as they are in treatment. We also have inpatient treatment. So this is like a short-term or long-term residential treatment program. So this is one of the things that we think of when we think of, or one of the things we could possibly think of when we think of drug abuse. So we look at it like, people are going to rehab. So that is definitely something that is very helpful. And these programs can be anywhere between 6 and 12 month programs for rehabilitation. These programs can also take a 12-step approach. So you may have heard a 12-step program. Inpatient treatment, again, is residential. So the person would move on to that site, and then they would be able to participate in individual therapy, group therapy, all under that 12-step approach. We also have outpatient treatment. So this could look like a day program, group counseling, maybe, outpatient treatment varies in the type of intensity of the services offered. So such treatment costs less than residential and inpatient type of treatment. And so this could be an option for those who might need some assistance, but they may not be able to afford it. And so it really is more so of a day program, and it's catered to the person's individual characteristics. There's also counseling. So of course, counseling is therapy. That could be group therapy or individual therapy. And that can help people begin to change their mindset about it or support them as they're coming off of a substance. One thing I do like about group therapy is that it does provide a level of support that some other programs, if you're trying to go it alone, you might not get that support, or even in individual therapy. You have your therapist who supports you, but sometimes it's really impactful to have other people around who have those same exact struggles as you have, and they are able to support you and come alongside you on your journey to sobriety. And then we also have added on here Family Medical Leave Act. And so this is added on here. This is actually something that I found out as a manager at my previous job, because I actually had an employee who's an alcoholic, and so he ended up leaving work and went into a therapy program, or a inpatient treatment program. And so substance abuse, it can get in the way of your normal activities, and it can interfere with work. And just as I stated, this employee of mine, who's actually a friend of mine now, it was interfering with his work. He recognized that this was an issue for him, and he enrolled into an inpatient treatment program. And so FMLA will basically, hold your job for you while you're in that treatment program, because addiction is considered a complicated disease that affects a person mentally, physically, and emotionally. And so because of that, then it is covered under FMLA. So, or it can be covered under FMLA once you have reached, you've got to be at work for a certain period of time, I believe. But that is something I actually went through in being the supervisor of someone who needed to utilize that resource. So that is the end of our presentation, and I hope that you found this information helpful. Again, please explore our wiki. We do have some videos of people in there who are giving their testimony of how they had they struggle with substance abuse and how they overcame that, and how many months they're in sobriety. And so that is a very positive thing. Substance abuse is definitely a social problem that does affect, as you can see, it affects so many areas of our society: individual, family, and relationships, and our economy. It costs a lot of money to help substance abuse, and so prevention programs and providing areas for treatment is very crucial and key for us to be able to continue doing our best to be a society that is a compassionate one, and one that is very focused on helping other people come out of something that could be and that is very tragic for them on an individual level and in their families. So thank you so much for your time, and we look forward to seeing you on the blog. Have a good day. Bye-bye.